Hello, my name's Kathy Palm. I have the honor and the privilege to be the Executive Director at Tully Hill since March of 1996. Thank you for joining us to celebrate our 30-year history. We faced many challenges over our years, from managed care in the 90s to the Affordable Care Act, the lack of enforcement of parity legislation, and most recently our COVID-19 pandemic. But over all these years, the board and the staff have remained focused on our mission, vision, and values to provide excellent care to our patients and their family members and loved ones. A brief look at our history. We opened on October 3rd, 1990 with services at the detox and inpatient rehabilitation levels. We were Joint Commission accredited. We had 35 staff approximately, and both our patients and staff smoked. We have a number of milestones. 1996, we decertified 6 beds and created a 75-person outpatient unit on campus under the same roof. In 2002, we negotiated a purchase of our land, building, and equipment. We had a caveat that we could have 1 year to raise significant funds for a down payment. We were successful with that, and October 31st, 2003, we closed on our land, building, and equipment, became the new owners. In 2011, we implemented our first electronic medical record. In 2016, we paid off our mortgage and a renovation loan. Tully Hill today, celebrating our 30 years. Most importantly, we continue to follow our mission, vision, and values. We have 70 professional and committed staff. We treat multiple addictive substances. Alcohol still remains our primary drug of choice. We continue to be a no-smoking facility in campus. We created a sophisticated IT department to secure our electronic medical record and other data. And we've invested several $1 million in capital renovations. I can't speak about our 30-year history without acknowledging 2 very important individuals and community leaders. One is Michael J. Falcone. Michael built our building, and he also helped us throughout our early years until we were able to purchase the property in 2003. The other individual is Francis J. Petro. He was our founding board chairman and continued in that role with great leadership, vision, and enthusiasm for the work that we do until he passed in 2017. Thank you for joining us. Thank you for your generous support and your belief in Tully Hill. You are helping us to continue to save lives every day. Thank you, and God bless.
"2020 has been an outstanding year of achievement at Tully Hill. In the latter stages of 2019 and in the spring of 2020, Tully Hill's licensing authority and primary healthcare regulatory agency, the New York State Office of Addiction Supports and Services, also known as OASIS, recertified our medically supervised detox and our inpatient rehabilitation level of care services and programs for another 3 years. In addition, in 2020, Tully Hill achieved recertification with LegitScript, the leading third-party administrator in the complex healthcare sector. This recertification designates Tully Hill as a facility that continues to meet healthcare standards nationwide for legality, safety, and transparency. A third achievement for Tully Hill in 2020 was its designation as a Blue Distinction Center for Substance Use Disorder Treatment and Recovery by its local healthcare plan, Blue Cross Blue Shield Association member Excellus, and the nationwide Blue Cross Blue Shield Association membership of 35 other healthcare plans. This membership now provides healthcare coverage for about 1 in 3 Americans. The designation is important because it signifies that Tully Hill's treatment and recovery programs meet nationally established Blue Cross Blue Shield selection criteria by demonstrating expertise in delivering multidisciplinary, patient-centered, evidence-based care with a commitment to quality and value. A fourth achievement to note for Tully Hill relates directly to its commitment to patient treatment outcomes. Not only are outcomes in 2020 remaining outstanding, but the fact that we're making them available for folks to see and review at www.tullyhill.com emphasizes our commitment to transparency as well, plus our commitment to the quality of care. Related to the treatment outcome efforts in 2020 were two other achievements of note. The first one was that we participated with 7 other facilities in the National Association of Addiction Treatment Providers in a 3-year pilot program study designed to develop and test a standardized outcome tool. That effort just resulted in the development and distribution of a standardized outcome toolkit. Related to those two efforts is a final effort that we undertook for patient treatment outcomes, and that was our joining with 6 other treatment facilities, nonprofit, high quality, like Tully Hill in the Eastern United States, to develop our own outcome study. And by comparing treatment outcome among ourselves, we can only improve our patient care. So 2020 was a great year of achievement, and we look forward to continuing that in 2021.
Hello, my name is Dr. Gregory Surfer. I am the Medical Director for Tully Hill Treatment and Recovery. I am here to talk to you today a little bit about the changes that we have made regarding the COVID-19 pandemic that is affecting the world. A little bit of background. COVID-19 is the name of the global pandemic that is being caused by a strain of coronavirus known as SARS-CoV-2. This is a new strain of the virus, and that's why many of you may have heard it referred to as the novel coronavirus. It has caused major changes in the way we all live our lives. Hence, we've had to make major changes here at Tully Hill to make sure that everybody remains as safe and healthy as possible, because that ultimately is our goal. The safety process starts with our admissions process and screening. Each and every patient is individually screened and their individual situation is evaluated, and a decision is made as to how that person will need to be approached in order to get them into our program. The approach may include testing for the illness. It may require a quarantine wait period. It may require both. As I said, each situation is different. Prior to even entering the building, the person will have to be evaluated by a nurse in our vestibule. The person will be masked, evaluated by the nurse, and then allowed into the building for a further evaluation. Family is no longer able to come into the building with you. The family member or close friend will wait in their car and be interviewed on the telephone to continue with the admission process. Once a patient does pass through our vestibule, they're wearing a mask, they come in and the intake process begins. How do we therefore keep our patients safe? Well, there are other measures in play. For example, social distancing. Social distancing is perhaps the most important manner of protecting somebody from infection. Secondly, hand washing and hand sterilization. All staff are issued their own personal hand sanitation device. Throughout the building, we have non-alcohol-based hand sanitation devices for the patients and staff to use. I had mentioned earlier that we are limiting the amount of people that are coming into this building. Another way that we keep our patients safe is our outpatient services have, whenever possible, been moved to a telemedicine venue. Instead of having our outpatients come to us, we connect with them by telemedicine. I would like to close with 2 points. We do have contingency plans in place should a patient manifest any signs or symptoms that would be suspicious for SARS-CoV-2, the COVID-19 infection. These plans would be immediately enacted to both protect the patient and the rest of the community and the staff. This is very important because this is how any further spread, should it be real, occur. Secondly, and this is very important and something we are very proud of at Tully Hill, not a single one of our patients has been diagnosed with SARS-CoV-2. Not one. For any period of time during their stay here, no patient has become ill with this infection. Further to that, to the best of our knowledge, at any period within 2 weeks following their stay here, which is the incubation period at its longest for this illness, no patient has developed SARS-CoV-2. This is a source of great pride for us because, again, our number one priority is to keep our patients safe, and we feel that this demonstrates that we are meeting that goal. I thank you very much for your attention.
My name's Carolyn, and I'm a member of the admissions team here at Tully Hill as an intake specialist. I am also a Tully Hill alumni. My time that I spent here is something that I will always cherish and remember. Tully Hill was the stepping stone, really, for my recovery. I can honestly say that I wouldn't be where I am today had I not made the choice to come to Tully Hill. Prior to coming to Tully, my life was a mess. It was complete chaos. Alcohol had really taken over every aspect of my life, from the moment that I woke up until the moment that I went to bed at night. I had gotten to the point where I physically couldn't do anything without having alcohol in my system. It not only took over my life physically, but it took over every mental aspect of my being. It was every waking thought that I had, and I couldn't find a way out of it. I had tried everything in my power to try and get sober on my own, but nothing worked. I needed a solution and a program that was going to help me to stay sober for the rest of my life. And that's when I finally came to the point where I picked up the phone and reached out for help. And that phone call happened to be to Tully Hill, and I'm so thankful every day that it was. What I found really important for me as a patient here was the fact that a number of staff are actually in recovery themselves. I could see how much that they really cared. You weren't just talking to somebody with a degree, you were talking with people who had actually been through similar situations as yourself. And I was really able to relate to that, and it helped me to feel more comfortable at this facility. The care and compassion that they have for the patients, it really shows and it shines. Coming to Tully, it's not just one program that's molded for everyone to fit into. They create a program for you, and that's why we do the treatment planning here. Is you sit down with your case manager, and after they get to know you, you discuss your goals and what you hope to achieve after leaving the facility and with your sobriety. And it's something that you can take with you from here. And it's goals that you've set in place that you would have never been able to accomplish on your own prior to coming to treatment. And being able to come back to Tully and work here has really it's been a gift. I've been able to come full circle, and it's one of my goals that I had set into place. I knew that leaving treatment, ultimately, I wanted to be able to come back and work in recovery myself. Being on the other end of the phone, I am that first point of contact for patients when they first call in, and I completely understand what they're going through because I was that person picking up and making that initial phone call. And because of that, I'm living the life that I have today, and I'm able to share my experiences that I've had and show other people who may not be ready to come into treatment that it's okay. You're gonna get there, and when you're ready, all you have to do is pick up that phone, and someone like myself will be on the other end of it to help guide you through the process. And once you're here, you know that you're home. Thank you for taking the time to celebrate our 30th anniversary with us this year. We look forward to helping many more patients in the years to come, just like they helped me in the past.